You have to do it for yourself, you have to do it for your family, you have to do it.
And now that my migraines can be fixed.
You got your life back because migraines can take it away.
It's just amazing that a little stimulation can take away that pain.
Everybody's looking for that miracle, and I'm convinced that I found it.
Here at Reed Migraine Center, our entire staff is fully committed to making this a positive experience for you and your entire family.
Since I've had the procedure, things have actually been really great.
It's interesting how all this got started. I'm a pain management specialist. I actually have 3 board certifications: internal medicine, anesthesiology, and anesthesia pain management. The last of which is the most appropriate one for the procedure we're going to talk about today. Implanted neurostimulation for headaches is a procedure that I originated. I was the first to do. We were the first to do it here in Dallas, Texas, beginning way back in the 90s, 1992. And over the years after that, we've developed this procedure to what it is today, a more perfected procedure, what we call a combined 4-lead occipital and supraorbital nerve stimulator as a treatment for severe headaches, commonly severe migraine headaches.
Patients don't know, but literally we're refining it constantly. Even from when I first saw the technique in the last 2 years, we've made a number of revisions and refinements. And the fortunate thing is because Dr. Reed has the largest study sample size, and we have the most patients of anyone in the world, he's able to glean data from that. And so we're constantly refining it, improving ways to do it. In fact, just recently, Dr. Will made some modifications to the technique that are great. And so I'm excited to tell my patients now that it's even better than it was 6 months ago.
The patients improve so rapidly and are able to improve their function. These are patients who a lot of times have had to go to the emergency room multiple times a month for severe headaches and pain, and they've been able now with the procedure to go back to work, go back to school, interact with their friends and family, not have the ER visits, not have to take as much medication, and it really has improved quality of life. And you just hear it when you talk to the patients for the post-op visits, even just the trials.
One of the most important things that patients should know about a stimulator and about the stimulators that we use is that they are unique and can be customized to your pain. Each stimulator typically has 4 leads, and you can turn each of the leads up and down individually. You can change the frequency. You can essentially change the volume. If you're having a bad day and you feel your migraine creep up, you can turn it up, like taking another dose of medication, except you just have to turn up your stimulator. As many migraine sufferers know, they may have different types of migraines. You can really customize it to your pain, which is one of the reasons why we like to stay connected with our patients years out.
Some other ways that our patients can find out information about Reed Migraine Centers: we have an excellent website, www.reedmigraine.com. It's a very, very wonderful website for patients to go. There's a great Q&A section with Dr. Reed himself. He answers any questions that the patients may have. We have patient testimonial videos on there, as well as links to our research that Dr. Reed has conducted over the past couple of years.
We wouldn't call it a cure, but as close as you could come to a cure. Dramatic improvement in the pain. At minimum, they have to have over 50% improvement, and the vast majority had over 80 and over 90% improvement. They're going back to work, back to school, and those are the terms we hear. I have my life back. It's night and day difference. I have my wife back. Our kids have their mother back. We get these kind of reports all the time.
It was like 90% better than I felt in so long.
It was honestly the best thing I've ever done, mostly because it gave me my life back, it gave me my family back.
They were awesome. Wake up, you've got to know this. My head stopped hurting, wake up.
It's just amazing that a little stimulation could take away that pain. It's awesome.
You got your life back because migraines can take it away. They can fix anything.
If you want to go to the seminar, that would be great. That way you can know if you're a candidate, and you might as well give it a shot. It saved my life.
Everybody's looking for that miracle, and I'm convinced that I found it.